Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Maria Iliakova. She's a bariatric and general surgeon. Today's Kevin MD article is Can AI Truly Improve Hospital Staffing? Maria, welcome back to the show.
Thank you so much, Kevin. It's really nice to be with you.
So, we were talking offline, and I know you've been on the show before, and you're a bariatric and general surgeon, but now your career has taken a little bit of an AI tangent. So, tell us what that is.
Yeah, I think a lot of people's careers, honestly, have been taking a little bit of an AI tangent. It's definitely the buzzword that's around everywhere right now. It's big and invested right now. A lot of companies are getting started around AI. So, funny enough, I actually worked on AI projects a long time ago when I was doing a master's in bioinformatics. I actually did some protein structure calculations and modeling, not the cool kind, but the kind that you do with Python ages ago, like more than a decade ago. And it's great to see these kinds of tools. They've taken a quantum leap, honestly, since that time. So, what we're able to do with AI tools now is just leagues beyond what we were able to do just 5, 10 years ago. And some of that is actually some interesting factors driving that. One is processing power has changed radically since that time too. So imagine, what cell phones used to look like
Mhm.
even 10 years ago, or computers used to look like 10 years ago. And now you can essentially carry a library of an entire library of songs in your or videos even in your phone, which isn't something we could even 10 years ago. So the processing power, computing power has changed radically. And then also, concepts like big data, for instance, have matured a lot in the past 10 years. We have databases of everything from patient information, for instance, to molecules and the ways that they interact, to even lots of data that Google, for instance, has been collecting on all of us and how we use our devices and technology. Though they do it for advertising purposes, it can obviously be deployed for other purposes too. So, yes, my career has yet again taken a bit of a detour into AI. Yes.
All right. So we're going to talk about one of those AI related articles. It's titled, Can AI Truly Improve Hospital Staffing? So tell us why you wrote this article in the first place. And then for those who didn't get a chance to read it, tell us about the article itself.
Sure, I'd be surprised if many people actually read it. But in short, basically, I think in healthcare, we know of AI, we've heard of AI, but we don't necessarily think we're using a lot of AI necessarily, and we don't really know how it's going to be applied to what we do or how it's going to change the work that we do. So this article is addressing that, but specifically asking the question of, what about one really, really important question and really important topic, which is hospital staffing. So, and hospital staffing is something actually that you're wondering probably why on earth is a surgeon talking about hospital staffing? Well, let me tell you, it is the bane of our existence when we don't have staff in the OR, for instance, because it delays our cases, delays our patients, and sometimes you have a surgeon. So over 90% of hospitals at this point are actually using locum physician staffing. So that's not just temporary nursing staffing, that's temporary doctor staffing. And that's 90%, not
Wow.
19, 90, which I think is pretty shocking. I didn't know that until I started looking into it. And I've had the privilege of actually working as a locum surgeon in hospitals in Iowa, in Missouri, in Florida, and a couple of other states, and have really started to understand that this is a crisis, especially for our rural and community hospitals, but it also reaches into cities and academic institutions as well. So, it really crossed my mind. What if we could use some AI tools to make hospital staffing a little bit better? We can't just create new doctors out of nowhere. Creating more residency positions is literally an act of Congress. So you can't just materialize people out of nowhere. But what if we could use the people we have? And that's exactly where things like AI can help us, is to use the resources we have in a way that maybe people haven't thought of yet, or people aren't as good at doing yet. This is combined with, the hospital where I was working in Iowa City, Mercy, Iowa City went bankrupt last year and became part of the bigger university institutions basically next door there. So, and one of the biggest factors driving that bankruptcy was staffing and the
Mhm.
inability for this small independent community hospital that had been standing for almost 150 years to actually staff physicians. So, it's a lot of different opportunities, but at the same time, figured it would be really cool to ask this question. In this article, I specifically talk about something that I was learning in one of my MBA classes. So, on top of all this, I also started an MBA, a full time tech MBA at NYU in May this year. And we actually do coding. We use Python, which is a programming language, and we use it in something called the Google Colab, which is a notebook that you can use to deploy code. And I was blown away. Like I told you, Kevin, I have done programming and things in the past, but the ability to have this powerful of a tool and not just to be able to start programming and coding right away, but the AI tool that was built into this notebook, it's called the Jupyter Notebook. It's created by Google Colab. And it literally was writing code for me as I was commenting on it. And the kind of insights you can get from that, the kind of understanding of data, the kind of images you can generate with that, it blew me away because it's not just ChatGPT and getting some random answers to things. You're actually generating the code itself, so you understand exactly how the results you're getting are being produced. So anyway, I really wanted to share my experience because as a doctor, I have not been coding for the past 10 years or so.
Mm-hmm.
So even someone like me could generate this in a few minutes using some powerful tools that involved AI. So that's what this is all about.
So tell us about some of these AI tools and how can that address some of the hospital staffing issues that you brought up earlier?
Yeah, absolutely. So I think we've all really felt the crunch, even if you're in a place that happens to be really well staffed. We all were affected by COVID, and we all saw people leaving the workforce and some not re-entering, some people not re-entering as full time. And then even people who are coming into the workforce are also much more cautious about signing up for full-time work or going to certain locations where there may be greater instability than others. So it's a really big deal. And then when you start asking questions as to like, how can we fix these problems? And we can't just generate more doctors.
Yeah.
What AI is really, really good at are things like sorting, recommendation, prediction, basically analyzing lots of data and coming up with trends, coming up with insights on that data. One of the biggest hurdles that I encountered as a locum physician in staffing was actually credentialing, which you wouldn't necessarily think that is not a sexy topic. Nobody's like, awake at night thinking about how cool credentialing is, maybe except me at this point. But it's a huge hurdle. So it can take months. I think every single physician has encountered a credentialing problem that they had where something just didn't come through on time, or they were left waiting for weeks or months before
Yeah.
they could start a job, especially if you're transferring states, because we do state licensing in this country for our doctors. And I mean, the last time that we actually credentialed somebody for a work assignment, it took 37 emails, 7.5 hours of work for 5 different people. And that was between a really motivated hospital staff, really motivated surgeon, and a process that was trying to move as fast as it could, and it still took that long. So I think every single doctor who listens to this will relate to how
Mhm.
annoying and time consuming credentialing can be, especially when you're trying to get a new job and just really excited to get started. Same time from the hospital side, it's a huge annoyance because it's losing them the ability to take care of patients, losing them money, losing them credibility. And if you don't have a doctor in a program, let's say a GI doctor for an endoscopy lab, you don't have nurses either. You don't have techs either. If your doctor isn't working, your whole team isn't working
Yeah.
oftentimes, so whether that's in a clinical setting or in an inpatient setting. So it's really a problem with reverberating effects. So the way that, I started a company initially called Surge, but we've actually rebranded to DocDocGo is the name of the company. What we do is we basically take documents, credentialing documents from doctors, and we have them upload them just as a document dump, basically the simplest thing that you can do. And we actually deploy AI on the back end in order to analyze the documents and fill out basically our digital forms for you to create a profile, to create a CV, and to create something that can be shared with employers, with hospitals, for jobs, with insurance companies, with electronic health record companies, and others. And it's something that can help you update your credentials, keep track of your credentials, renew them when needed. It's actually kind of shocking to me that something like this doesn't already exist. But the best thing out there that I've seen is FCVS, and that's not comprehensive. And it doesn't really help track things, and it's still kind of difficult to use, honestly. So we deploy AI to be able to do a lot of that manual work that doctors otherwise have to spend dozens of emails doing or filling out forms by hand. And AI just makes that process a lot faster and actually a lot more accurate too.
So just give us a sense of that piecemeal approach that physicians have to use for credentialing. You mentioned that they have to have like dozens of emails just to get documents. Just give us a sense of how many parties are involved, how many documents a physician has to give out and look for and hunt down. Just give us a sense of that complexity.
So it's a great question. And the kind of the most difficult part of this is that even though we're doing this over and over again, it's pretty much the exact same documents that every hospital is requesting every time.
Hmm.
So it's really, really a process that's ready to be standardized and it's ready to be made the same between different hospitals. But what you're trying to find for yourself are things like your degrees, your diplomas, your certificates, your credentials for your residency program, fellowship, your state licenses, your DEA, your CDS, your ATLS, BLS, ACLS, your CV is part of it. Even your medical malpractice coverage is a part of the records that are requested, and even something like immunizations. And Kevin, I was born in Russia, so half of my immunization records from being a child are in Russian.
Hmm.
So let me tell you how easy that is for hospital administrators to read and be able to use as part of my credentials. So it's a field in which you're trying to get all these documents, and some of them are handwritten documents. Some of them they don't exist online. You just have this thing that you've scanned a million times and it barely looks like English anymore, even if it started out as English. And it's something that it's ready to become something that doesn't require us to spend hours or days hunting down documents and then emailing these documents, many of which are actually pretty private, like your DEA information
Hmm.
or your immunization record, your medical records. We're literally emailing these back and forth with administrators. And on average, this process takes 3 to 6 months. It costs over $1,000 to collect and verify all of these documents per time that you do it. And most of these kinds of credentials, like your state license, BLS, ACLS, that kind of thing, they require renewal every 2 to 3 years.
Hmm.
And you're spending quite a bit of money and quite a bit of time making sure that all of that happens. So I really don't know a doctor, if you talk to them about credentialing, that hasn't gone through pretty dramatically negative experience doing this.
So after using this AI approach, how much time does it cut off the typical credentialing process?
Yeah, so it actually allows us to, once a doctor uploads their records, and we actually are involved in helping them find their records. And in some cases, we're actually able to integrate with other databases online, like NPI databases and others, to be able to pull those records automatically without the doctor even having to upload those records. Kind of cool. It becomes a minutes to hours process rather than a month-long process. And that is a pretty interesting proposition, not just to the doctor, because it's convenient and makes life a lot easier, but really to hospitals, because now hospitals can hire and verify credentials in a way that simply didn't exist before. And there are some incredible administrators that we've worked with to go through these kinds of credentialing processes. Every single person that I've worked with at every hospital that I've had to credential as a locum physician, I think is a saint, because they go through this and basically they hand over hand, document by document, making sure that everything on that checklist is there and is
Hmm.
appropriate. But that's a really great system to automate and not have to have a person do. On top of that, the administrators that are typically helping with credentialing typically have other jobs too.
Yeah.
So it's not like they'd be sitting on their hands if this was taken off their plate. I don't know a single person whose only job is credentialing for doctors or making sure that all those records are right. It's usually somebody who has a lot of administrative hats. And sometimes I've even interacted with people like CEOs of hospitals or CMOs of hospitals or even CFOs of hospitals in this process, because it's such an important process, but such a really difficult one sometimes in the way that we do it now. So it really frees up a lot of people to be able to actually do more meaningful work. And also, even just reducing the burden off of doctors to not have to spend hours to days hunting things down is, I think, would be really wonderful in my life personally. It's just a personal product I really wanted to.
So just to be clear, it cuts down that months long process to something that now takes hours.
Yeah, minutes to hours, depending on how readable the documents are. The cool part of the process too is we're testing with a couple of hospitals on the hospital side as well. So they're able to upload their documents, and their documents get digitized in exactly the same way. So think of like your onboarding documents being able to be auto-completed with the records that we already have for the doctor you're hiring. So again, that process becomes, instead of someone having to send a bunch of emails and manually fill out forms, whether it's the administrator, the doctor, or both, it now literally becomes a digital process that happens automatically once a doctor and hospital are matched in our system. So it's, yeah, think of it, it's also the same way. I mean, it really could be applied to a lot of things, any kind of application process for school. I would have loved to have done this for my MBA program where I could just click a button and my entire CV gets uploaded and I don't have to sit there manually typing it out and filling out a form. But this is exactly what AI processes and computerized digital processes are made for, is to get rid of that busy work, to get rid of what we call in our industry scut work, right?
Yep.
Nobody wants to do that.
So in your article, you touch upon other ways AI can improve that hospital staffing issue nationwide. So what are some other ways that you talk about?
Oh yeah, absolutely. So some really interesting things that we're hoping come out of this work that we're doing, this project, but and many others are also working on, is actually figuring out what kind of staffing do we need? When do we need the staffing? Who do we need? How many nurses do we need on a floor? How many patients are we anticipating? How many surgeries are we actually performing on what days? Are there peaks? Are there trends? Do we need to be staffing two surgeons at this time? Do we be staffing one? Do we need to be staffing a specific kind of doctor versus a specific kind of nurse for different things? Again, that's something that's a really great field to use AI recognition, recommendation, and prediction tools to be able to figure out. Some other interesting things that I think are great is you can even place not just time, but location data into this and figure out, for instance, if a hospital has more than one location, or not even more than one location, but they transfer to other hospitals or they accept transfers from other hospitals, those are also trends that you can evaluate over time. And you can come up with ideas as to what you can expect in terms of transfer volume to or from your hospital, where you need to deploy what resources to address the patient volume that you're anticipating. So again, it just becomes a really powerful way of helping hospitals schedule the appropriate workers for the work that needs to be done. Because you and I both know that doctors and nurses sitting around doing nothing does not help anyone. And most doctors and nurses and people in hospitals like to be busy if they are working. So, and it's not like you can do other work. It's not like, oh, we can do a podcast while we're on call. It's not really, or, you can't go garden, or you can't go get groceries or something else. You really, if you're in the hospital, you're in the hospital. So we might as well be using the staff that we have in the best way possible. And also, it doesn't make sense for hospitals to be paying staff to just sit around if that's the case. So it's really critical to match volume and demand with supply. And that is another application that AI can really help us with. Some other things that kind of drill into the details of that are dynamic staffing. So for instance, being able to have appropriate backups available, or being able to shift people or flex people between different units, specifically for nurses or techs or nursing assistants, MAs. So I mean, really the applications are pretty endless in how we can improve staffing from where we are now. One other huge thing that I haven't mentioned, but I think is an enormous opportunity for us, is to improve telehealth staffing. So for instance, neurostroke has been around in the US for about a decade. And it used to be that less than 20% of the country had access to a neurologist to diagnose and manage a stroke within 20 or within 30 minutes, which is the national standard. Now over 70% of the country does, because telestroke has become the standard of care in many locations. And there's a process of credentialing, shocker, I know I'm going back to that topic, of being able to allow neurologists specifically to be proxy credentialed, meaning if they're affiliated with an institution, say NYU, for example, if there's a real hospital that contracts with NYU to recognize their credentials, they actually don't have to go through the credentialing process all over again. Their credential at NYU serves as a proxy for them to be able to virtually see patients at another hospital and assess them for stroke and to be able to deliver that timely care. As a result, morbidity and mortality have dropped where this is deployed. Satisfaction has certainly dropped. Cost has dropped. And now you have real-time access to a neurologist to be able to diagnose and treat a stroke for a patient, which is life-saving care in many cases. So being able to apply these kinds of AI tools and credentialing and being able to even allow hospitals to adopt more
Mhm.
telehealth, even in the procedural space, which is completely currently unexplored, but starting to become possible because of robotic consoles. Yeah, there really are endless applications.
We're talking to Maria Ilyakova. She's a bariatric and general surgeon. Today's Kevin MD article is Can AI truly improve hospital staffing? Maria, as always, will end with some of your take home messages to the Kevin MD audience.
Yeah, so I think one of the biggest ones is when we're deploying AI tools, there's a lot of opportunity, but there can be a lot of cost as well. So something we didn't really touch on, but I do think is an important takeaway is that AI is a tool, and every tool, it matters how you deploy it.
Mhm.
If you were to use a scalpel to try to fix someone's diabetes, that probably is not going to work. So similarly, if you try to use AI in an inappropriate way, or for something it's not made for, or without thinking about how to deploy it, it not only may not get the job done, it might cause harm. So it's really, really important to engage people who know how to use AI, who are thinking about the social, ethical, and even privacy concerns involved in using AI before it is something that becomes systematically used or used in something as high value as healthcare. So that's a really big takeaway that we didn't really talk about, but I think it's really important to mention. And then two, I think starting to think about what AI can do for us to make us better. AI at this point or at any point in the near future will not replace doctors. And that's great news in a way, I hope, because what doctors do that cannot be easily replicated or replicated at all by any technological tool so far is to validate results and to take responsibility for those results.
Mhm.
So it's liability basically. For better or worse, doctors are uniquely capable of assessing and making a final decision for a patient's care and the liability associated with that. And there is no tech tool, AI or otherwise, that replaces that extremely valuable asset of a physician and what we're trained to do. So thinking of AI, and this is kind of the third takeaway, is two, basically AI is not going to take your job as a
Mhm.
doctor. But three is AI can really, really help you do your job better because if you know what to anticipate in terms of your patient volume, if you know that you're going to have the staff that you need, if you know that you can basically sign up for a job and go rather than wait 3.5 months or 4 months or 5 months to get your credentials ready. If you know how to take care of your patients better because a lot of the scout work is being done for you, these tools can be very powerful in how we use the resources we have now, use the number of doctors we have now to actually take care of this nation's needs and nation's hospitals.
Maria, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you so much, Kevin. It was such a joy to be with you.